Hello, my name is Tammy Melton. I'm an MSN student at Eastern Kentucky University. Today I will be presenting on information gathered for my integrative review paper on the effectiveness of CBT for the treatment of anxiety in adults. Common symptoms of anxiety that were focused on in the 3 studies reviewed included excessive worrying, physical symptoms such as restlessness and muscle tension, panic, and fear. According to a study by Woodworth in 2015, anxiety does not become a disorder until it begins to interrupt or impair an individual's functioning. According to 2016 statistics from the National Institute of Mental Health, 18.1% of adults suffer from some form of anxiety, and 22.8% suffer from a severe form of anxiety. 2 randomized control trials and 1 prospective randomized trial were reviewed for the purpose of evaluating the effectiveness of cognitive behavioral therapy, also known as CBT, on the reduction of anxiety symptoms. Donegan and Dugas conducted a randomized control trial in 2012 to compare CBT with applied relaxation. They examined the effects of these interventions on anxiety symptoms such as worry and physical symptoms in a group of patients who suffer from generalized anxiety disorder. This study provided support for CBT as an intervention for reducing anxiety symptoms. Heinonen, Burke, Pallison, Back, and Nordis conducted a randomized control trial in 2010 to compare CBT with standard care combined with phone contacts. They examined the effects of the interventions on anxiety symptoms in a group of patients who suffered from COPD. Anxiety symptoms in the CBT group significantly improved from baseline to post-treatment and during follow-up. Perry and others conducted a prospective randomized trial in 2012 to compare CBT with routine clinical care. They examined the effects of the interventions on asthma-related anxiety symptoms of panic and fear in patients who suffer from asthma. Significant reductions in asthma-related panic and fear symptoms were found in the CBT group. The absolute reduction in these symptoms even increased at the 6-month follow-up. A synthesis of literature reveals support for CBT as an intervention for reducing anxiety symptoms in the adult population of individuals who suffer from some form of anxiety disorder. Studies support CBT efficacy in reducing anxiety symptoms. Studies provide support and evidence for the use in practice. Efficacy was found for short and long-term use of CBT. Treatment resulted in greater control of symptoms, and CBT was found to complement standard and routine care. CBT implementation can easily be incorporated into routine clinical care. The benefits of using CBT as an intervention far outweighs the risks. Utilizing CBT as an intervention has the potential to greatly improve nursing practice in the mental health field. CBT offers alternatives to traditional treatment for anxiety with medication alone. Cognitive behavioral therapy offers numerous interventions that can be tailored to meet the needs of patients who suffer from different types of anxiety symptoms. Some of these interventions include psychoeducation, problem solving, worry awareness training, relaxation, fear-based exposure, sleep management, cognitive therapy, controlled exposure, and identification of fears, beliefs, assumptions, and triggers. Any healthcare organization that provides healthcare could benefit from CBT as an intervention. Anxiety is not only common in the mental health field, but it is also common among patients who suffer from physical problems as well, due to worry and fear about their physical health. Outpatient mental health clinics, inpatient psychiatric hospitals, private mental health clinics, medical facilities, hospitals, and school clinics are just a few of the healthcare organizations that could benefit from CBT. Thank you.